Hey, I'm Dr. Travis Owens, and I'm so excited to get to work with you at the Aussie Gold Cheer Conference. Now, our upcoming topic, we're going to touch on injuries. Now, injury prevention and rehab is a huge passion of mine, and is something that I love getting to help gyms, athletes, coaches to deal with and to get in front of, so that we have a plan if somebody gets hurt, so we can try to prevent injuries as best we can. But just to get your minds kind of wrapped around what we can do to keep our athletes healthy, and try to reduce season-ending injuries and in some sad and bad cases, some career-ending injuries. So over the course of the next hour or so, we're going to go over some of the more common areas that people have injuries. We're going to talk about why these things happen, and we're also going to talk about how we can prevent some of these things from taking place. The areas that we're going to focus on are going to be our wrists, ankles, low backs, and knees. Now, although we may not be able to cover the entire body in this hour, we will cover these very, very common areas where we do have injuries more often, or athletes are more prone to injuries. But also I will share with you guys some resources for other areas of the body and give you guys a checklist of what you can do to make sure that your gym is prepared for when, if and when these injuries do happen. So I'm excited to share some of this information with you, and let's jump right in. All right, guys, so I'm so excited to be here with you guys talking about injury prevention and rehab. Such an important topic in cheerleading, and is one of the main reasons why I got into this field of healthcare and trying to work directly with cheer athletes. I had a lot of injuries, chronic injuries throughout my cheer career. My biggest issue was my knees. I had chronic knee pain that lasted pretty much the entirety of my time that I was an athlete. And in dealing with that, it became something that I wanted to try to do my part to prevent future athletes as much as I could from having to deal with a lot of the same things that I went through. And it's interesting now, because I actually see athletes that have the same diagnosis that I did when I was cheering, and by understanding now how these injuries happen and being able to look at it through a different lens, we're able to resolve these pains and these injuries that these athletes have in a very short period of time, usually within just a couple of weeks. 1 to 2 weeks, we can have this pain dialed down. And so knowing that there are answers out there, it gives me a lot of hope for our athletes. And what I hope to impart on you guys today is understanding some of the common injuries that we have, understanding why those happen and how we can prevent them. What's really great is if we understand why injuries take place, then we can lay out very straightforward steps to prevent them from happening as best as we can. We never want to guarantee that no injury will happen, because accidents can happen, but we can dramatically lower the probability that we'll have those big, season-ending and career-ending injuries. And so with that, we're going to jump in. Obviously, we can't cover every single injury that an athlete could face. There are quite a lot of them, but I do want to just get your gears turning on what some of the common injuries are. I also want to share with you guys some resources to help to prevent some of these things, and then also share some resources that dive deeper into other areas of the body that we don't cover directly in the lecture. And as always, if you have questions about anything that we cover or anything that we don't cover, I'll have my contact information out for you guys, and you can reach out to me directly, either through email, through phone, or through any of our other social platforms. So let's jump right in. So cheer athletes and injuries. So in order to understand how these injuries happen, we have to talk about what the anatomy of a cheerleader is, the anatomy of the cheer athlete. So forward pelvic tilt is a very common thing that we see. Is basically when someone's pelvis, if I were, say, I was holding my top girl like I were going to toss her up, if her pelvis is tilted forward and her low back is arched too much to the front, which leads us into that second point of excessive lower back curve, excessive hamstring flexibility, which we do ourselves. We do this to ourselves. Weak glutes and hamstrings, or glutes, the muscles on the backside of the hips, our butt, our hamstrings, unstable ankles, which we're going to talk a lot about, large hair, and so much glitter. So the reason I put this slide here, and this is actually a slide that I use to teach other doctors about how to manage cheer athletes and cheer injuries, is that we have to manage our athletes differently than other sports because the demands of our sport is much different than other sports. Our competitive time frame is only 2.5 minutes. So I'm looking at a cheer athlete much differently than I look at like a soccer player, rugby player, basketball player, etc. And so the one thing I want you guys to keep in mind as we talk through these things is a lot of these imbalances, a lot of these injuries that our athletes have is because of the imbalances that we just talked about. And those imbalances we create ourselves as coaches and as program owners, etc. We create this, and it's because we have specific demands that we want the athletes to be able to do, and so we push them to specialize to get those skills with little regard for the imbalances that can create, and that sets them up for injuries. And I know it's not done maliciously. By no means am I saying coaches are causing injuries. It's nothing to that point. The way we train our athletes inadvertently leads them to where they're teetering on the edge of these injuries until it happens. So I want you to keep that in mind as we go through these things, because if we know that the way we train is causing a lot of these injuries, then we also know if we change our training methodology, we can reduce the amount of injuries that they have. So getting into injury types. So what are injuries? Like what different types do we experience? So when you hear the word sprain is involving a ligament, and a ligament is a structure that holds two bones together. So if you have a bone meeting a bone, the ligament is what connects those two things together. If we have a strain, that is involving a muscle. So that is when we injure a muscle. Obviously, muscles are what move different parts of our body. And that can also involve the tendon. The tendon is what attaches a muscle to a bone. And so if you hear about an athlete having a strain, that is going to involve the muscle, or if somebody pulls something, that is the equivalent terminology of a strain. If it's a sprain, that is a ligament. Now, typically a ligament is going to heal more slowly than a muscle or tendon will, and it's due to the type of structure. A ligament does not have blood flow directly to it. Muscles do. When you look at these structures inside the body, muscles are red, they have nice blood flow. Ligaments are usually white or opaque, which means they have little to no blood supply, and also means they heal a little bit slower. A contusion is an impact injury. Let's say if we have a top girl that's falling out of a stunt and she elbows her back spot in the head, that's going to be a contusion injury or an impact injury. Fractures we're all familiar with. We hear, fracture and break. For some reason, there's a misconception that somebody says like, no, I didn't break it, I just fractured it. They're the same thing. So a fracture is a break in the bone, and that doesn't always have to be a traumatic fracture, which we'll talk about when we get to the spine. But fractures can actually come from repetitive stress, and the bone finally just gives way. Lacerations, we don't typically see a lot of if your athletes have their nails trimmed. We don't see a lot of lacerations. Those are our cuts. And then concussion falls into the contusion type injury, so it's more of a contusion to the brain. Concussions are a really important topic that I think deserves an entire lecture for our sport, and it's because even though it's spine and ankle and all these other things we talk about are some of the more heavily reported injuries, concussions are probably the most common injury in our sport and are the least reported in the sport, because a lot of times kids will get they'll get their bell rung, and instead of following up, we just kind of let them, if they can walk and they can move and things like that, and they're not dizzy, we kind of jump right back in. The medical liaison for USASF, Dr. Lindsay Stevens, is a colleague of mine that actually we live here in the same city in San Antonio, Texas. She is my go-to for concussion protocols. So anytime I have an athlete that has a head injury that I'm concerned about, I send to her. And the reason that those are so important is because concussion protocols change on an annual basis. That's one of those things that I do not get into is concussions. And it's not because I don't think they're important, it's because the protocols are constantly evolving for how to properly evaluate, how to properly treat. I mean, think about this. A few years ago, if someone had a concussion, we told them, do not sleep, don't go to sleep. Now, the recommendation is sleep, is brain rest, and they recommend that for up to 6 weeks of reduced activity and like minimal activity, as much bed rest as you can get, trying to allow the brain to recover. So those protocols evolve very, very often. And so having someone who specializes in concussions is extremely important. So I tend to lean towards someone who stays up to date with those things. So at the end of our talk today on injuries, one of the recommendations that I have is to have providers that you're comfortable working with, or that to connect with your program, so that you have support in the field for when these injuries happen. So concussion is very, very important. So moving forward, good old ankle sprain. So this is the most common injury that I treat. The type of practice that I have in the United States, the chiropractic license is different than other continents. I know in Australia, there's a Master's of Chiropractic, I believe is the predominant degree. In the United States, the chiropractic program is a doctorate level program. We are what is called portal of entry, meaning that people can come to see us with an array of ailments or injuries, and then we have the right and responsibility to diagnose that injury and then determine, can we treat it? Is it something that falls into our scope of practice? And if not, we have the ability to refer out to specialists. So the specialty that we focus on here is musculoskeletal, so muscle and skeletal type injuries, and ankle sprains falls right into that category. And so I see a lot of ankle sprains, and especially with cheerleading. And so we have to first thing we ask ourselves, why does this happen so often? First of all, our athletes are on unstable surfaces. A spring floor is a very unstable surface, right? So it's designed to have some give, and it allows for some benefit on one end, but it also provides an unstable surface for athletes on the other end. So it can be helpful, but it can also be detrimental. Additionally, the shoes that the athletes wear are designed to be as minimal as possible. I remember when I first started cheering back in the early 2000s, the shoes were completely different than they are now. I mean, there were actually teams I was on that the girls basically wore almost like a high top, just a sneaker. In college, our girls wore like some of the Nike, back when Nike was still making a really popular cheer shoe. It was almost like the Nike Cortez, which was similar to the shoe that Forrest Gump wore in the movie when he was running. But the shoes have evolved essentially to where they're as minimal as possible, and they're very flimsy. They don't provide really any support, but it's that risk benefit of the benefit is it's a lighter shoe. A little bit more form-fitting, but we're risking stability and protection from our ankles. And so we take that unstable surface and we take a shoe that doesn't really provide a whole lot of support. And then additionally, we have risk factors that include a previous sprain. So if you have sprained an ankle in the past, there's an 80+% chance that you will re-sprain that ankle if the appropriate steps aren't taken to prevent it. Some other risk factors include weak hip muscles, like the muscles around the glutes, and also poor preparation, which we're going to cover today, and hopefully give you guys some ways to prep so that we can reduce these. But the hip muscles, the reason that happens is anytime we are moving laterally, let's say to the side, if I jump to one side and I land on my foot, I have my foot, my knee, my leg, my hip all the way up from the ground. I've got structures all the way down the side of the leg that will support me being able to land on that foot and stop and hold steady. If I don't have a lot of control from the hip, my hip will continue to shift versus using that glute to kind of hold me in place. That shift from the top will roll me further and will predispose me to rolling that ankle. And that's what that weak hip muscles means. The other thing is, and this gets back to that piece that we talked about, how cheerleading basically we create these injuries essentially. If we look at how an ankle sprain happens, which is usually the toe is pointed and we roll it kind of like this. So my foot is planted and I'm kind of rolling it like that, okay? Cheerleaders live in a toe pointed position for the majority of their career. And it's because we demonize flexed feet. We say, okay, if your foot is flexed, that's ugly. You know, you have points deducted for cleanliness of activity. So if an inversion sprain that we're looking at here happens when the toe is pointed and we roll, the toe pointed is half of an ankle sprain. So the kids are living in half an ankle sprain all the time. And so it doesn't take much to then turn that ankle and get the other 50%. And by having the athletes always with their toes pointed and not getting comfortable in a flexed position or being strong in that flexed position, when they go to turn that ankle, those muscles are not capable of resisting that turn because they never used it that way. And so what ends up happening is when they have that one small odd step, they're not strong enough to save that ankle from turning, and so they sprain it. And then if we don't rehab it properly, they're already predisposed to an ankle sprain. They had an ankle sprain, and it becomes this cycle where they're living with a taped ankle or an ankle brace forever, and they're constantly in pain. So preparation for this is huge. And so we look at prehab. How do we try to minimize the amount of ankle sprains that we have? One of the easiest things that I tell all the athletes that I work with, he said, if I could give you one thing that would help to prevent these ankle sprains, it would be heel walking on your heels. And again, that comes back to the way that our sprain happens. The toe is pointed and we turn it and roll to the outside. So if I want to strengthen the muscles that would prevent that, I would pull my toes up. I would lift my toes up and I would work the opposite direction. And so what I tell most athletes is spend 3 minutes a day walking on your heels. Simple, right? When you're at the gym, walk on your heels for 3 minutes and strengthen the muscles in the front of your lower leg to prevent that turning, okay? But for this, what we have here in this prehab section is an easy progression of moves that you can do either in your conditioning or as part of your warm-up to reduce the amount of ankle sprains that we have, right? So first of all is toe walking. So we don't want to eliminate strength in the calf. Calf strength is very important. So the way that I laid this out is basically if you were at the beginning of a practice, you'd have your athletes walk down nice and slow, toe walk on their toes with their arms overhead, nice and slow, taking their time through these, toe walk all the way down. And then if you want to do it one direction, that's it. Or if you want to have them do it down and back, either way, whatever fits into the schedule for your practice. But have them do a toe walk down and back, then a heel walk down and back. Now, one thing I see with athletes is they get lazy with this. They get really lazy where they're just kind of letting their heel tap the ground and then their foot just falls and they almost like they're walking normal. The point of this heel walk is to try to stay off of the ball of the foot and off of the toes as much as possible. We only want the heels to be in contact with the floor. The other thing with the heel walk is we don't want them sticking their butt out. We want them keeping their butt tucked under as they walk so that the strain that they feel or the muscles they feel working are only in the front of the shins, okay? So heel walking, very, very important. Forward hops and back hops. What I mean by that is one foot hopping forward and hopping back and forth, in place, right? One foot, forward, back. Usually 30 seconds per side is perfectly fine. And then our side-to-side hops, again, one leg hopping. I like to do these over the strap that holds the mats together. So they'll be on one foot, hop over the strap, back and forth, looking for soft landings and being very mindful of their positioning. So we don't want them getting in a rush and then potentially rolling their ankle with trying to do the ankle prevention. So side-to-side hop over the strap that holds the mats together. Walking arabesques, again, walking down the floor. They're just going to be on one foot, kick the back leg forward, reach down towards the floor. Again, using the hip and the glute and the ankle and that single leg balance type stress will help again to build stability. and then side-to-side shuffles across the mat, basically in a low squat position, shuffling to the side and then shuffling back. So we're getting some dynamic side-to-side motion, and we're getting some single leg balance motion. The walking arabesques are hugely helpful because it's really tying in the foot, the ankle, the calf, the glute or hip muscles, and how they all work together to provide stability for the ankle. So using this as part of your warm-up is extremely helpful. Or having athletes do this, at home or at the, coming in a few minutes early and doing this, or just having it as part of your conditioning towards the end, I think is also a great idea. But just plugging these things in can be very, very helpful. Transitioning from ankles, we get into low back injuries. Now, these are spine injuries are things that I really don't play around with. And what I mean by that is if I have an athlete that has a low grade ankle sprain, let's say they have a level, grade 1 ankle sprain, which is a minor ankle sprain, maybe a little bit of swelling, a little bit of pain with walking, but for the most part, they can still do things. There's a really good chance that I would allow that athlete to compete as long as they were taped up well, supported, they were already in a rehab program, we're working on getting this thing better, because with a grade 1 ankle sprain, I am less concerned that they are going to have a traumatic life or career affecting injury in a 2.5 minute routine. Is it possible? Yes, but the chances in all the years that I've been doing this is very, very, very low. However, spine I do not play with. And the reason is spinal injuries can be extremely life-affecting for these young athletes. Unfortunately, it does happen very often. And again, it comes back into what we talked about is we create these injuries. And when we have spine injuries, there's stages of these injuries. There is a lot of times, a traumatic, like a fall or something of that nature, but most of the time, these injuries specifically are chronic. This is something like an athlete shows up in our clinic with low back pain. It is typically something that they have felt for a while, and it's just now gotten to the point where it's so bad that they can no longer go without pretty high level pain. The mechanism of injury, how these things happen, is repetitive extension. So the low back extension is leaning backwards. So back handsprings, dances, different parts of our choreo, all these different things have repetitive extension, and at a young age, that amount of extension can be detrimental for their back. So we have stages of spine injury. Think about like stage 1, 2, 3, 4, and it's based on the severity and the time or the chronicity or how long they've been dealing with it that we typically see these things. So facet syndrome is typically your first stage. This is where the joints in the spine are getting irritated from too much impact, kind of bone to bone, and that repetitive extension. The spine is kind of banging into each other. Spinal bones are banging into each other. That creates irritation at the facet or the joint that they line up. On our picture here, it would be this line right here. This is our facet. I'll get my laser pointer right here. This is our facet joint. Okay. The stress reaction is what comes next. Let's say if we have that pain that starts and we continue to go. We continue to push, and now we get to a second stage. A stress reaction is actually when the bone itself starts to get swelling or bruising, which it can happen. That's a very common thing that can happen with repetitive bone injuries is we can actually get swelling or bruising in the bone. And that's not good because it makes that bone susceptible to fracture. Bones need to be hard. When we add fluid to them or swelling or bruising, it makes them softer and makes it more likely that they will fracture. So that's our stress reaction. Number 3 is our stress fracture. And what this x-ray shows here is actually a stress fracture. We're looking at a lower back x-ray in this image here. And if you look carefully, and I'll highlight it with our laser, this little shape here kind of looks like a Scotty dog. It looks like a little dog. So here's his ear, here's his nose and his face. This would be his front paw, his back paw, and then his tail's up here. So, and then here's another one here, ear, nose, front, back legs, tail, and his back. What we're looking at here is, if you notice, this Scotty dog has a separation here. There's a dark line right there between his head and his body. So we would say that the Scotty dog has a collar on. And what that collar is a dark space where bone is not present. And if we have that, that tells us that there's a fracture at that spot. Now, this can happen traumatically in a big impact. More typically, though, it will happen with repetitive stress. And so when an athlete comes in and they've got either a stress reaction in the bone, which you would find through an MRI or a CT scan, or a stress fracture, which will show up either with an X-ray or an MRI, then I know that that athlete has been hurting for a while. And that is a big problem. That's something that I really want to impart on you guys, is eliminating the fear culture behind injuries. More often than I can tell you, it breaks my heart when these kids come in and they have these injuries, and I ask them, how long have you been hurting? And their answer is not for a week or two, it's for months. Since the end of last season, since the beginning of this season, since middle school, and they're a high school athlete. These things don't happen overnight. And when I ask them, why did you wait until now to say something? Their answer is some form of, I was scared to tell my coach because I didn't want to get pulled off the mat. And that fear that they have is something that we owe them to get rid of. As their coaches, as their parents, we owe it to them to eliminate this culture of fear behind injuries. Because if we catch an injury at the facet syndrome stage, where the facet is just, that joint is just slightly irritated, that's a couple of weeks. It doesn't take long. And in the meantime, there's things that they can still be doing. You know, they may not be able to tumble to their full extent, but they can still do choreo. We can still work on jumps. We can still do other things without having to pull them completely off the mat. But when they get to that stress reaction, stress fracture phase, now we're talking like 6 to 8 weeks. If it's a stress fracture, potentially longer, and they're wearing a brace. And if it gets further than that, we get a full fracture. We get that phase 4 at the bottom, which is that shifting. So if the bone breaks on both sides, that big part here, this big square, can actually shift forward, and now we've got, needing surgery potentially. And so it accelerates, and it gets real bad real fast once we get past certain points. So the goal is to not let it get to that point. We want to catch these things early, and the only way we can do that is if we tell our athletes, hey, if you're hurting, let us know, especially in the spine. It's too aggressive of an injury to overlook, and we definitely don't want the kids to think that their role on the floor is more important than their health. And so I urge you guys to talk to your athletes about the importance of back health and spine health, because these are injuries we just don't want to play with. So for the back, let's talk about how we can prevent these things and some of the things that I use in the clinic. So this is why this happens. And these big words, erector spinae, glute medius, don't stress on the big words. What this is saying is the reason that this happens most often is we've got super tight low back muscles and tight hip flexor muscles. That's accompanied by weak abdominals and weak glutes. Now remember, we talked about in our anatomy of the cheerleader, weak and super flexible, but weak glutes and hamstrings. This is what that's talking about, is our tight hip flexors, weak glutes, weak core, and tight low back muscles. And so what ends up happening is we get into this kind of rocked forward position and the imbalances that come with that. And so we look at, okay, how do we prevent this? Or how do I, if I do have an athlete that I'm working with, what are some of the things that I use in the clinic to take care of these things? First thing we want to look at is core strength, okay? So the core strength, we're looking at a couple of exercises here, our bird dog, our pull-off press or side plank, and our modified plank. So these movements are all designed between the three of them to cover the majority of the musculature around the spine and the pelvis to stabilize and strengthen and try to eliminate imbalances around there. The bird dog is right here at the bottom, this picture of me here, reaching with my left arm out and my right leg behind me and keeping the back as flat as possible. That's working what's called a cross crawl pattern, which helps with rotation stability. And so by extending one arm in the opposite leg, we're working that crisscross or rotational patterning. Very, very helpful there. That also is working our glutes and ties the shoulder in as well. The shoulder, the glutes, the low back, believe it or not, all work together. Our pull-off press or our side plank, this is working some of the oblique muscles on the side of the body. This picture here with this gentleman in a band, what he's doing is he's holding the band close and he's pressing the band away from him, the band being tied off to a point a little bit further away. Once you press that band out, the band tries to rotate you or pull you back towards it. And what you do is by just extending the arms out, you're resisting that pulling rotation. And what that does is that works those rotational stabilizers without actually having to rotate. So it's an anti-rotation exercise. Here in the top image, this is our side plank. I prefer to keep side planks on the elbow. I don't see any further benefit of doing a side plank on an extended arm. I see a lot more risk with injuring a shoulder or a wrist. And so if you want to make a plank more challenging, stay on the elbow and then lift your top leg. You can do reach unders where you're reaching underneath the down arm and then reaching back up. That's another way to increase the difficulty there. But I prefer to stay on the elbow. And for athletes that have that struggle with even the elbow and the feet, you can drop to your knees on a side plank also and have your elbow in your knees and still get benefit out of that. That's going to be for more of time, looking like 30 to 60 seconds. The other two moves so far, we're looking at more repetition based. And then our modified plank, which is done on the knees, you'll see this image here of me and you'll see the words "as you exhale" and a green line that rolls over my back. What I'm showing in that video is you're in a modified plank with your elbows down and your knees are down as well. As you exhale, you want to contract the core and try to tuck the pelvis of the butt under and really almost like you're pulling your elbows and your knees together. Now, this is not done necessarily, this version is not done necessarily as holding it for a minute. What I typically will show athletes is you want to inhale and exhale, squeeze down, try to hold that contraction while you inhale again. So I inhale and I get further down. And so I'm trying to kind of ratchet the core tighter, tighter, tighter. Usually 3 to 5 breaths is about as much as you'll get, which is perfectly fine. And you would do 5 or so rounds of that 3 to 5 breaths. Our guidance for our coaches on this should be, this can be something, again, that's tied into your conditioning. It can be something that you have the athletes do at home. You can have them do it as part of their warm-up, honestly, as their prep, because this is, again, rewiring some of the patterning and the way that they move. So having these things done beforehand isn't necessarily a bad thing either. But the guidance for our coaches, teach proper hip flexor stretching, which I'll show you guys here in just a moment. Stop stretching hamstrings so much. Is hamstring flexibility important? Absolutely. Is it so important that the only thing that we focus on is stretching for splits? No, it is not that important. And in fact, is one of the major reasons why our kids have so many low back and knee injuries is overly flexible hamstrings with no control. So they are super flexible, but they got no strength to control that range of motion. So we have to stop only stretching the hamstrings. We need to incorporate our prehab strengthening into our conditioning routines. Teaching and also teaching the athletes to be mindful of excessive low back curve. So if we point out to them like, hey, you're walking around with your butt sticking out and your back has got this super big arch, and we point that out to them, they can be more mindful to, hey, maybe I should brace my core a little bit. Maybe I shouldn't walk around, kind of waddling around. This less J-Lo, more Michael works for more of like our age group. The kids probably won't understand it so much, but you'll see what I mean here. Less of a curve in the back, more pelvis tucked under, using the core to tuck under. So less J-Lo and more Michael. So this is the video I wanted to show you guys with the hip flexor stretch. I have it marked here at 232. This is a video I did working on introducing other thought processes behind getting splits and your flexibility, not just stretching the same things over and over again. So here I show at the 232 mark, I show what I meant by a proper hip flexor stretch. Basically what we're looking at is we're down on a knee in a lunge position. And then from there, instead of just driving the hip forward, what we're actually looking at is tucking our pelvis underneath and then leaning slightly forward so that we feel a big stretch in the front of the hip pocket. And it's ironic that our kids can do splits but still have tight hip flexors. I know it sounds really obscure, but it's definitely a possibility. So this video, I'll make sure that you guys have the link for it. But at the 232 mark, I'll show you what a proper hip flexor stretch is. So getting into our next area where you are looking at the wrists. Now the wrists are a common area of injury that we see when our kids are tumbling or stunting. The wrist is a very common place where we can have some of those issues. And so when we look at the wrist, it's very, very important that we evaluate these properly. If the injury is a traumatic wrist injury, our athlete falls, they have pain immediately in the wrist, we want to get that evaluated to ensure that we don't have a fracture. If they get an x-ray done either the same day or the next day, it's imperative that we have another x-ray done about a week and a half or so later. And the reason for that is fractures can be hidden in the early stages and then can show up later. And I've seen this happen a few times where an athlete would fracture their wrist, go to get an x-ray. X-ray doesn't have anything that shows in the first time, yet a week or two later, they're still having swelling. It still hurts like crazy. And then they go back for a follow-up, and sure enough, that fracture that was there was hidden at first, and then they could see it at a later point. The other thing we want to keep in mind is growth plates in the wrist don't close until later and, past the age that they could start cheering. So we want to make sure that if we have a wrist injury, that we, especially for a younger athlete, that we rule out possibility of growth plate fractures, because that is extremely important and we don't want to affect the long-term health of the wrist. Location of pain is everything. And what I mean by that is pain here versus pain here versus pain here versus pain here versus pain here. They're all different and they're all vary with level of severity and importance, essentially. This side of the wrist is an area that typically is going to hurt in tumbling with twists, like if they're twisting or if they're stunting and they have a twisting piece here, usually like our main base. This area of the wrist, there is actually a little structure there that's almost like a meniscus in the knee, like a cartilage disc that can get injured there. And there's a lot of ligaments around this side of the wrist, and it's because we have extra range of motion there. So whenever we see that much range of motion, we know we need added support. And so this can be an area where we have an increase of soft tissue injuries like ligament injuries that can take a little bit longer to heal. This side is where we typically will see some of those fractures that we're hiding out. So if an athlete has pain right at the base of their thumb and they're pointing that it hurts there, and when they put weight on it, it's extremely painful, definitely want to rule out a fracture with x-rays. So when we look at our prehab, we look at activities of the wrist and forearm. Our warm-ups are extremely important. Wrist and forearm strengthening for the muscles around the forearm are shown. Here's a couple of videos that are found on my YouTube channel. One involves some stretching activities for the wrist. The other one involves a wrist warm-up using a band. Again, both of these will be available to you guys. They can be found on my YouTube channel. Very, very easy to follow. That bottom video just shows using a simple resistance band to work the different directions of the wrist to strengthen the forearm muscles that control the wrist. And then that top video there, what Alan is showing is different stretches that we can use to get the wrist, elbow, and shoulder warmed up for things like stunting and tumble. So The other thing we need to look into is making sure that we ease into weight bearing on the hands through different warm-up activities. I'll oftentimes see we kind of just rush into, let's jump into handstands or blocking drills, or jump straight into round-offs and back handsprings. Spending a good bit of time easing into weight bearing on the hands can be extremely helpful. And what I mean by that is, as part of the warm-up, you can have things like push-ups, burpees, doing just kick-ups into handstands to start with. Just easing into kick-ups into your handstands can be very, very helpful. But instead of just going straight to back walkovers or back handsprings, more easing into the amount of load that we put on the hand and wrist can be extremely helpful as well. When it comes to wrapping and bracing, good old white athletic tape is a go-to. I got so used to using that during my cheer career that even now when I go to work out, I will still wrap a little bit of tape around here. It's just a little bit of extra support there. In the gymnastics world, they use tiger paws. You don't see that a ton with cheer athletes. And that wrist widget that you see at the very bottom, what that wrist widget is actually a wrap that's used for the injury on this side and can dramatically decrease the amount of pain that your athletes have if they do sprain this. TFCC is what this thing is called. So look into the wrist widget. Can be exceedingly helpful with this side of the wrist when they have injuries. And I use those quite a bit with our athletes. So another very important area that we have injuries, unfortunately very common in the sport, is our knee. And usually when the knee is hurting, it is a pretty bad injury, unfortunately. We have our ACL, meniscus, and some of the other structures in the knee. When it comes to the knee, if the knee has a trauma, like I landed a full twisting, landed funny, it's usually a pretty straightforward answer as to what it is. If the athlete reports a pop, pain initially, and it swells within the first 12 to 24 hours, we have to rule out meniscus, or I'm sorry, ACL. It's basically the rule of thumb. If they have pop, pain, and swelling, is it's ACL until it's ruled out. And the way we rule that out is by MRI. The meniscus is a wafer of cartilage that sits between my two leg bones, and can have similar symptoms as the ACL because they're connected to each other, but you typically will not have the pop that comes with the ACL. So if you have pain and swelling, or if you get some clicking in the knee, like when you go to bend it, it clicks, or if it feels like it locks on you, that's likely going to be a meniscus injury. The MCL and the ACL and the meniscus are all connected on the inside portion of the knee. Right here is where the ACL, MCL, and meniscus all meet. So anytime we have pain in this area, we want to rule out those three things being culprits. The LCL and the PCL, these are very low likelihood, if I can get my words out, very low likelihood that you're going to see an LCL or a PCL injury. The LCL is the sister to the MCL, so the MCL is on this side. The LCL is all the way over here. Rarely do we see LCL injuries in cheer. And the PCL is the twin for the ACL. So the ACL prevents the knee from shifting this way. The PCL prevents it from shifting the other way. Again, rarely do you see a PCL injury. But usually with an athlete, if they have trauma, i.e. I'm tumbling and I landed, I felt a pop and pain, it's likely the knee that's the problem. Clearly, right? However, if an athlete has pain at their knee without trauma, the problem isn't the knee, that's just where they're feeling it. And we'll make sense of that here in just a second. If you have pain at the knee and you didn't injure your knee, it means that there's something in the way you move that is putting unnecessary stress on the knee. And if we look at just the knee, we're seeing basically the car engine light. We see the light on, but we are ignoring the light and trying to cover the light up. Let's say we put a piece of tape over the light. Well, there's something going on in the car that's making that light come on. So we have to determine what that is. So things that we can do as coaches is we can look at how our athletes move and evaluate some of their movement patterns. This is very similar to what I do in the clinic with some squats and some lunges. So If we have our athletes squat, we want to see their knees line up over their feet. We don't want to see them collapsing inward. And we also don't want to see them hinging super far forward like we have in this image here. So we want to make sure our knees aren't collapsing inward. We want to make sure they don't have a super wide stance. That's another thing I see all the time is cheer athletes will, instead of squatting lower and bending their knees more, they just shoot their feet out so wide and create this really unstable base to perform in. Not healthy for the knees, not good for the back either, and it's not safe, especially if they're lifting someone. So a very wide squat stance, we want to bring that in somewhere between the shoulders and the hips. And then again, hinging heavily at the waist. We don't want to hinge forward like that. That puts a lot of stress on our low back and takes a lot of the balance of a squat using the quads or our thigh muscles and then use our hamstrings and glutes. It takes out the balance of structure usage and puts us a whole lot into the low back and the knees or in the quads right here, which would likely give us pain in the knee and pain in the low back. So squat technique, very, very big. Secondly, we can also look at lunges. So this link here is a video on the YouTube channel that I was telling you guys about that talks about how lunge technique can be a very big indicator for knee health. If they're lunging, as you see in that left image, and their knee is collapsing in, their hip is uneven, that can tell us that we've got some glute weakness that can affect their knee health, but also we can use it as a test to see my body positions, like my Liberty. Why are my girls' hips hiking really high, or why are they unstable when they do their libs? Using a lunge test to see are they weak in their glutes can be a really easy way to show why they are unstable, because they may have a weak glute. Which then after that we give I give some exercises that you can do to strengthen their hips, which will make not only their body positions better in the air, but is also going to help to prevent knee injuries, which is good. 2 for 1, right? So looking at their lunge technique, this video here walks through that and teaches you guys how to use lunges as an evaluation for your athletes. Very, very helpful. So getting into some preventative things that we can do, some prehab for knee injuries, and this honestly ties a lot into the lower back too, which is great because we're getting a 2 for 1. We are really looking at strengthening our hamstrings and strengthening our glutes or our butt muscles. So the movements that you see here are all things that are used to strengthen what's called our posterior chain, or the muscles in the glutes, hamstrings, calves, and low back as well, but mostly glutes and hamstrings. So glute strengthening are bridges, which here at the top right, we can see a bridge being performed. We would start with the hips flat on the floor, driving the hips up, squeeze the core so we don't arch too much in the back. We want to keep the core tight, and we're squeezing up through the glutes, should feel a contraction in our butt muscles. The second is our banded squats, which we see here in the bottom left. Using a band that's cut into a loop, we can wrap that around the knees and we can squat down and then stand back up. Again, that activates more of the butt muscles in the squat and helps us to keep from having too much quad usage or thigh muscle usage without using the glutes as well. Our monster walks, that's using the band here in the bottom right around the ankles. You can put it around the feet also and kind of give a different version. You can also put it around the knees as well. But what you're doing is you're putting the band around the legs, you're taking a wide stance, and you're walking forward and backwards, trying to keep your feet as wide as possible. And you can even do side-to-side stepping with that. Again, strengthening the muscles of the glutes and of the hips. And then for our hamstring strengthening, the Nordic negative, which is this exercise in the top left, with the gentleman that's angling himself forward. With that, you would either need to have an athlete hold the other athlete's feet, or have them where they can hook their feet underneath something sturdy that is enough, heavy enough that it won't lift up. And what they're trying to do is lower themselves as slowly as possible down towards the floor until they cannot control it, and then they would reach out, catch themselves, and slow themselves down. With the Nordic negative, this one you only perform like 5 to 7 reps of, and you would do 2 to 3 sets of that. And the idea with that one is you want to control it as long as you can. This exercise, actually, believe it or not, this exercise was studied heavily in Australia. There was a study that was done with the Aussie Rules football leagues that were out there, and they were having this massive spike in hamstring injuries. And so what they were trying to do is find out how can we get rid of these hamstring injuries that are plaguing our players. And so By using the Nordic negative, they did it, I believe it was twice a week for 7 reps, twice a week. So 14 reps total. They reduced the amount of hamstring injuries in that upcoming season by I think like 60 to 80%. It was dramatic. So that Nordic negative is a gold standard exercise for building hamstring strength. And by building hamstring strength, that helps us to create balance with tension in the knee, so we don't have too strong of thigh muscles and too weak of hamstring muscles. And that also helps our low back because the glutes, the low back, and the hamstring all work together as well. And so when one is not working, the others have to make up for that work. And so by having strong hamstrings, will decrease the risk of low back injuries as well. So you get kind of a 2-for-1 there as well. So getting into our to-do list, we want to connect with a provider in your area, right? So you want to find someone near your gym and introduce yourselves to this person and vet them, make sure that they are somebody that would be a good fit for you. Usually a sports chiro or a physio are going to be a great option to, sit down and have a conversation with them. Hey, this is our sport. If they're not familiar with it, educate them a bit on what the demands of the athletes are, and try to find a good connection for someone that you can build a relationship with to help support your athletes and your families. Make a prevention plan for the gym and stick to it. So the best laid plans of mice and men always go awry, right? So we talked about all these things that, that can be implemented to reduce the amount of injuries that our athletes have. But if we only talk about it, nothing happens and we don't really get anything out of it. So it doesn't have to be this massive overhaul to how you do things, but just having a plan of saying, hey, we're gonna focus on ankles this month or this week, or we're gonna do one exercise for ankles, one exercise for core, one exercise for knees, something of that nature. But having a plan and sticking with it is extremely helpful, because without having something set that everybody's on board with, when these injuries happen, if we didn't make a plan and we didn't stick to it, then it's like, we have that frustration of, man, would this have happened if? And we never want to have that what if thought when it comes to our athletes. So make a plan that you can stick to, that makes sense for your program, and stick to it. Invest in things like foam rollers and lacrosse balls. These are tools that we use to roll out tight muscles. You'll see them utilized a lot on my YouTube channel and on the Instagram platform that we put a lot of content out on. These things are hugely important. I take foam rollers, lacrosse balls, bands, and like percussion guns. I take those with me to every competition for the athletes to use to help with loosening up tight muscles, helping with some of the aches and pains that come with long seasons. So investing in those things is extremely helpful. Other thing is to think about strength training over just working on flexibility. One of the biggest problems is that we focus too much on flexibility, not enough on strength. And that's why we have an entire topic that I'm excited to do with you guys, strength and conditioning for cheerleaders, and what the best things that we can do are. I'm really excited about that, but start letting your mind kind of wrap around what can we implement on a strength level that's helpful versus just endless stretching or just cardio, right? We see that a lot. Like, we're gonna do 20 minutes of running, push-ups, and sit-ups. Like, that's not what our athletes need. And then the biggest thing is eliminate the culture of fear for the athletes when it comes to injuries. Let them know that it's important for them to talk to you when they're hurting and to not fear ruining their career, their season, or ruining, the team dynamic or whatever, because it's much easier to address these things if we catch them early, much easier. As someone who treats them on a regular basis, I can promise you it is much easier to fix these injuries early than to wait and then try to fix them at the end. And for most of us, we know the biggest competitions are at the end of the season. And so the longer we wait, the bigger the risk is that it's going to affect the team negatively than if we were to have addressed it early on. So thank you guys so much for joining me. I really hope that this is helpful for you guys in kind of getting your minds wrapped around injuries and preventing them. Again, if you have questions about injuries specifically, or if you're just looking for more resources, on YouTube, youtube.com/thecheerdoc, you can find all of the videos that I put out. That content is completely free for you guys, and is constantly being updated. So definitely check that out. And if you have any specific questions about injuries or about how to get connected with somebody in your area, please feel free to reach out and I'd be happy to help you with that as well. And I look forward to connecting with you guys on the other topics that we're doing. Nutrition will be one of them. And then again, strength and conditioning, very excited about that. We'll catch you guys on the next topic. See ya.